Thanks, Taylor. And this morning's medical alert, a common virus is really making its way through Maryland daycares right now. It's called RSV, which is a respiratory issue that usually impacts young children. Joining us this morning with more is Mercy Medical Center pediatrician Dr. Ashanti Woods. Good morning.
Good morning, Jennifer. How are you today?
I'm good. Can you explain RSV? What is that?
Sure. So RSV, or respiratory syncytial virus, essentially it's a bad cold, and it picks on the youngest of children, usually under 2 or 3 years of age. Everybody, including adults, can get RSV. And when you're older, when you're 5 and older, it just looks like the common cold. Common cold, of course, being upper respiratory infection. So above your neck, you might have some congestion, stuffy nose. In that population less than 2 years of age, however, especially premature infants, you can get not only the stuffy runny nose, a lot of congestion, but you can get fever, you can get irritability, which concerns parents. They just have a child that they can't seem to settle. And then they often have a very bad cough, sometimes followed by throwing up. And some parents even witness some wheezing in their very young child.
Well, in a world with COVID, that has to freak them out, right? They must be thinking automatically, oh no, it's not RSV, it's COVID.
Absolutely. And a surprise to us, the medical professionals, is that we started seeing cases of RSV in July, which is when we were starting to see a peak of COVID cases as well due to the Delta variant. So you're very right that it can look similar to COVID. Typically, RSV is a now infection. A now infection means November, December, January, February, March. That's typically our RSV season. So the fact that we saw a lot of RSV cases in July and the fact that they're persisting now, as you mentioned in daycare, it does have us concerned.
And it's contagious, right?
It is very contagious. It's spread like a lot of colds, which are respiratory droplets. So when you cough or when you sneeze, and if you, the recipient, have your mouth open or you breathe in that respiratory droplet, you can become infected. But again, much like COVID, if someone were to sneeze and cough onto a surface and that surface hasn't been wiped down, and then you, the recipient, touch that surface and then put your hands in your mouth or your eyes, you are in fact at risk of catching RSV.
So if you think your kid has RSV, keep them home, don't send them to daycare. But when does it become a little more serious and you need to seek medical help?
When you think your child has respiratory distress, and respiratory distress is just going to be characterized by nasal flaring, so the muscles of the nose are going in and out. There's a neck muscle right here. If you see that neck muscle going in and out, almost like there's a suction device underneath the skin, or if you see the rib cage going in and out, those are signs of respiratory distress. That would be one reason to seek medical help. Another one would be dehydration. So if you feel that your child isn't taking milk or Pedialyte, that's a reason to go in. And then if your gestalt as a parent just tells you that, wait a minute, my kid just doesn't look right, that would be a reason to, 1, call your pediatrician, or 2, seek care at an emergency department.
Let's talk vaccinations real quick. How's that been going?
So vaccinations are going well. Again, COVID vaccine is available to all children ages 5 and above. They're getting the Pfizer vaccine. It's 2 shots, 1 shot, and about 3 weeks later, you get your second shot. Going very well. The children who've been getting vaccinated so far, we in the medical community have not seen side effects that are alarming to us. So far, well tolerated. This is children, again, who have received their first dose, and many of them will be due for their second dose pretty soon. Of the age 12 and above who've been getting vaccinated since May, also very well tolerated. So we, pediatricians, parents, teachers, we're in conjunction and saying that this is a very safe and effective vaccine. And we want to encourage people to not only get their COVID shot, but then to also get their flu vaccination as well.
All right, Dr. Woods, thanks as always for joining us. Appreciate it, and happy Thanksgiving.
Same to you, Jennifer. Take care.
You too.